I am couple centric, there is no doubt in it. At the end of the day, your affordability is really a matter for me. So this IUI cost is anywhere between client profile, clinical profile and the current situation. Everything has to be taken into consideration. When I interact with the clients, with the couples, I will understand their clinical profile, the financial position. Then I can give them the solution. Husband is giving the semen and that semen is not injected directly, which is having major changes. Anywhere between 200 rupees to 3,000, 4,000 rupees is a wide difference. My concern is very clear. I am preparing them. That's all. I want to be very cost conservative. This is the client's profile. Good day. Now we are into the part 3 of no IUI, no IVF ICSI. No IUI ends end to end ends with success. So what is this third part? Having completed the first part about success, second part about the steps, now we are into the third part. As usual, third part comes as the cost. So for me, success is the priority, cost is the secondary. But I am couple centric. There is no doubt in it. At the end of the day, your affordability is really a matter for me. So I will be very cornered in that way. That doesn't mean I am going to give complete attention on success without understanding your financial situation. Otherwise, this topic wouldn't have come on third because we have 12 topics. I could have been posted this cost in the 12th topic. Why are you posted on the third topic? It's very clear. Next to success, your cost should be a consideration. Okay, so now we have to understand what will be the cost of this IUI. It is like basically we are giving this speech and publishing in all social medias. Let's understand the cost what we are disclosing, whether it is an IVF or ICSI or natural conception or IUI, everything is constrained to our country, India. Okay, so this may not be really applicable in overseas countries outside India. So, but we can understand many people are coming here for treatments as medical tourism, infertility tourism, so many things are happening. So you have to have clarity for that reason. Okay, so this IUI cost is anywhere between 5,000 to 15,000 per month. Okay, why is this range so wider? Why it is not between 5,000 to 7,000? Why not 5,000 to 8,000 or at least 5,000 to 10,000? Why is this wide range is there? So you need to understand. Let's understand what are all the costs involved in it. On the second day, you have been subjected to a very basal scan, right? This basal scan is somewhere between 500 to 1,000 or 1,500 rupees will be incurred the charges. Then you are from the day 10 till that maturation of follicle, maybe you will be subjected to scan for 4 to 5 sessions on alternate days from day 10, day 12, day 14, day 16 or even day 18. So those 4 to 5 scans completely together as a concept, we call it as follicular tracking scan, anywhere between 2,000 to 4,000. This is the second cost. The third cost is like you have been going through this semen preparation and IUI insemination, right? So this is a procedure they are doing in a very sterile room. Okay, their husband is giving the semen and that semen is not injected directly. That semen is being processed. The unwanted semen is removed. The active motile sperm is being isolated and separated, and that sperm only is injected. So it's called sperm preparation. So for preparing that sperm, it goes with a cost. It goes with the professional charges. So there, with the semen insemination, with the IUI procedure done by the gynecologist, it will be around 3,000 to 5,000. So then the last cost is like you are going some medications to grow the eggs. Sometimes along with the tablets, they are giving small amount of hormone injection, or you may go through only hormone injection, which is having major changes. Anywhere between 200 rupees to 3,000, 4,000 rupees is a wide difference. So that is where we got a differentiation, this 5,000 to 15,000. So now we have understood this IUI cost. How are we going to select the cost? I say it's purely customized. It's like, what is the client profile, clinical profile, and the current situation. Everything has to be taken into consideration. Couples are coming of average age group, married for few years, and they're trying for IUI. They are very desperate. In their cases, I can seek for good results. Say, imagine elderly couple above 40 years who are financially challenged, who don't want to go for IVF ICSI directly. As I mentioned, even when they need IVF ICSI, because of that age, because of so many other indications, still they are trying IUI, even at the elderly age group. I'm recommending that. Don't think it negatively. Okay, I'm recommending for them. I don't want to be too considerate. I will be trying only with tablets, because my concern is very clear. I'm preparing them. That's all. I want to be very cost conservative, basis the client's profile. So this is I will be very, very customized. One way, when I interact with the clients, with the couples, I will understand their clinical profile, the financial position. Then I can give them the solution. The end, that's very clear. I will give the opportunities, I will give the cost, and I will give the possibilities. The decision is the couples, whether they want to try only with tablets or tablets with hormone or purely hormones. I can recommend, I can suggest, but decision should come from the client. I can do one insemination. If you inject the sperm once, it's called single insemination. There are some institutions who are giving double insemination IUI, which goes with the marginal increase in the success rates, which goes with some additional cost for doing that semen preparation and doing that procedure. So by that, what happens is, we have to really understand, if we are going to give all the ways very transparently, what are all the costs involved for each and everything. Let the couples take the decision whether they want to try one insemination or double insemination or hormones or tablets or a combination. Everything, it is like they can choose, and it can be on a one-to-one mutual discussion, and a decision can be arrived. So this is how we have to move forward. So in my case, if I say IUI cost, understand it's only 5 to 15. And if as I mentioned, cumulative IUI will go with better success, and cumulative IUI will give a better preparation when you are unlikely ending in failure and entering into IVF in the second attempt or third attempt of failed IUI. There you should be looking for better success. That is my core interest. So accordingly, we need to fix the plan for the cost of IUI. I can finish per sitting for 7,500 and make you do for 3 sittings or 2 sittings. Accordingly, we can plan. So these are all some things very clear. But at the same time, I will tell you, I see so many times couples coming from abroad for only 1 month, and they are coming on the day 2. They are fixing they are anticipating the menstrual cycle, and they are coming in such a way, in the shortest time they get the second day, they complete the treatment itself within 1 month. To that couple, can I tell them 2 to 3 months preparation or cumulative IUI? No. Only they are coming mentally prepared for directly for ICSI. So where is the scope for giving this counseling? So it's all customized. I am trying to go by a step-by-step approach wherever it is possible without shortcuts. That's all. So now you got the clarity about this cost of IUI in part 3 of no IUI, no IVF ICSI, no IUI end-to-end will end in success. Okay. GSSSS is IC. IC means infertility ends in conception. Be positive, end with positive, and a healthy baby. So let's see in the part 4.